Lymph nodes. Now, the good thing is you don't have to worry about knowing all of the lymph nodes. Okay. Um, you do need to know that if they're swollen, that is bad, not good. Okay. They should not be visible, and there should be no reports of discomfort when palpating any lymph node, whether it's in the axilla, the breast, the neck, supraclavicular, preauricle, any of those. Okay. We talked about that already. Using the finger pads to make small encircles. Now, I have a couple handouts here for you because you know I'm the handout king. And I do want everyone to take one of each because, ladies, you might have to educate a patient on how to perform a testicular self-exam. Okay? And guys, you might have to teach a patient how to do a breast self-exam. Okay? So I have one of each, like infographics for each. Okay? Take that. All right. Now, when it comes to palpating the breast, though, there are a couple of different ways. It depends on what the patient feels most comfortable doing. You can do the zigzag, you could do the pie wedge, or you could do a centrifugal. Nipple and working your way around. So see if there's any type of abnormalities or inconsistencies. Okay. How would you be able to figure out, though, if it's just like a blocked milk duct versus a lump? You can massage it, and you might have some nipple discharge with it. Okay. Also, too, a blocked milk duct. Does that sound comfortable? I would say no. A blocked milk duct, would that be comfortable? No. So, palpation, we want it to be non-tender, but premenstrual breast may be tender and nodular. Again, that's considered expected. Okay. Anything going on with this one? It's red and excoriated. Okay, there's some issue. I mean, you can't even see, right here is where the nipple is and the areola, but you can't really see it from a certain distance. So there's something going on there. It could just be some type of material that the lady's bra, if she wears one, you know, maybe she's developed an allergy or they use some type of product in it, a finishing product that she could be allergic to, but we don't know. Okay. We need to note elasticity, if there's any discharge or tenderness. Let's see if there's any drainage. We talked about these already. Oh, if you have if your patient, has any irregular nodes, we need, of course, to note the location, the size, the shape, the consistency, all those fun things. Okay. So some signs and symptoms of breast cancer are obviously a lump or a thickening, some skin dimpling, so that peau d'ange that we talked about earlier, where it looked like there were just a bunch of dimples. Okay. Change in skin color or texture, clear or bloody fluid that leaks out of the nipple, or in a change in how the nipple looks, like a pulling in of the nipple, that inverted nipple.
Okay. What could cause a blood discharge from the nipple?
Cancer. That's why it's under signs and symptoms of cancer.
Ah, yes. Good call.
Or it could be a super bad infection that's really irritated it to where it's leaking blood, but typically it's breast cancer. Okay, so here are some more examples. Some redness going on around the nipple here. A little bit of pulling in too, so a little bit of an inversion there. Okay, over here, a little bit red, a little bit of dimpling going on too. Huh? She's like, there's breasts on my screen. Okay, here's that Buddy Check 12 thing I was talking to you guys about. But what I want you guys to kind of look over with these handouts is, one, what grade level do you think these are written at? Are they using any type of medical jargon or anything like that? No. The general public, it's estimated, has a reading level of about 8th grade. Okay? Yeah. That's why pretty much any type of education handouts that we give to patients, even stuff from the government, the IRS and things, your tax forms, they're all written at an 8th grade level. Okay? So you need to be able to explain all these things that you're learning here in nursing school at about that level. Okay? Now for those of you who want to work with peds, you're going to have to learn how to break it down even more simply. Okay? Now, can you explain stuff to a toddler? No. Okay? But beginning about what stage of development do you think you should start involving the actual patient?
8th grade.
4 years old. Well, 3, 4. When they start understanding, you explain to them.
3 or 4 is toddler age. They're not going to understand. They'll understand pain and hungry and stuff like that.
When they're 8 years old.
But I would say more school age. So 8 to 12, roughly about that time frame. Okay? Because when do girls start developing? They can start developing around 8 years old. And they're not going to know what that means when they start having their cycle, usually. Okay? And as guys, we tend to mature a little bit later. Yeah, and some of us not at all. Okay. Talked about the breast self-examination. 4 to 7 days after the start of their menstrual cycle is when the breast tissue is less full and tender. So about a week after their cycle has finished. Okay? Or excuse me, the start of their cycle. So towards the end time frame. Now, do all ladies experience the same amount of, or the same length of a menstrual cycle? Some women have it for 3 days and that's it. Some women have them for 8 days and are in complete agony.
Some of them have them for a month. No, I'm just playing. I'm just playing.
Dude, we are severely outnumbered. Don't fuck around right now. Let me just put you there right now. There's only 6 of us and you're 7 of us, okay?
Gotta be out first.
You all the way over there. The door's right there, okay? There's at least 6 of them around you that'll get you first. All right. Now, it is suggested that with either a breast self-exam or a testicular self-exam that it is done in the shower. Why?
Because you're already naked.
That's part of it. Huh? Well, you're squishy? Well, your muscles and your skin is more pliable and relaxed. More squishy. Like, I'm still squishy. I'm not in the shower right now, Miss Thing. But yeah, it's easier. Your skin gets a little thinner, and so it's easier again to palpate in those areas. Same thing with scrotal skin, because there's muscles in the scrotum as well that help regulate the temperature of the testicles. So when it's more warm, the skin's gonna be looser. Okay. All right. Here's a picture of a mammogram. So now, when it comes to mammogram screening, there is varying recommendations, but for our purposes, just anyone over the age of 40. It says greater than or equal to 45 on here, but just remember, anybody greater than 40 typically should have it done every 1 to 2 years if there's a low risk for breast cancer. So there's no family history, they're maybe approaching menopause type of a thing, okay? There's an increased risk at the start of 40. That's why I'm saying 40 years old, not 45. Mammogram screening should continue until around age 75 or longer, depending on their expectancy. Okay. Now, the tricky part is, like I said earlier, if you have a family history of any type of breast cancer, or actually any cancer, You want to know what that family member, when they were diagnosed, and then subtract anywhere between 4 to 10 years, depending on what type of cancer it is, and go from there and start screening other family members at that point. Okay. Cancer sometimes can be deadly overnight if it's not caught. I worked with a gentleman one time who he was not feeling well all night long, and he hadn't been feeling great. His energy had been low and everything for a couple of months. And finally his wife, who was a nurse, got him to go to the doctor, and he was Hispanic male, very, oh, I'm fine, type of a thing. They went in and did a liver biopsy and found out he had stage 4 liver cancer, and he was dead within 4 weeks. So it does not take long with certain forms of cancer. Pancreas is even worse. That one's a hard one to fight. Okay? Documentation. Remember, subjective and objective data. Subjective is what the patient tells you. Objective is everything that you see, hear, and can measure or reproduce. Okay? Teaching provided regarding self-breast exam with return demonstration, mammogram screening, all that fun stuff. How can you tell if a patient understands what education you've been giving them? Repeat it back to me. Teach back. Okay, not just, oh yeah, I understand. Because I guarantee if they're just saying, oh yeah, I'm good, they have no idea. Okay. All right, which of the following tools or techniques should you plan to use during a breast assessment? Let me give you a couple answers here. For a breast assessment, you don't need sterile gloves. You don't need sterile gloves. You just need gloves. Yeah. So yeah, definitely inspection. You're going to look. Look, listen, feel. Okay? Which of the following requires further investigation? Small raised bumps on the areola, dark brown nipple pigmentation, discharge from one nipple, or nipple retraction since puberty? Ooh, we have a couple of there. You have C's and D's. C, discharge from one nipple. Yes, nipple retraction could be, but if it's since puberty, they're still developing. Okay, so their tendons and things that help hold everything in place might not be stretching along with everything else. Okay, would you want to keep an eye on it? Yeah, but not at this point. But discharge from just one nipple and not both, that's an issue. Something to look into. Okay? Oh my God. That's it. Yay. Now, what I would like you guys to do for the next 20-some minutes, okay? Huh? Sleep? Is that what you just said? Nap time. That would be awesome. But your infographic here, okay? I gave you one for testicular and one for breast self-examination. What I would like you guys to do is to get into your clinical groups.